Good morning.
Morning.
My name is Levy. I'm the nurse. I will be taking care of you.
Okay.
I'm going to close the curtain for privacy.
Okay.
And I'm going to wash my hands for hand hygiene. So what brought you here today?
I've had flu symptoms for a while.
Okay. Do you have any other medical history that we need to be aware of?
No.
Are you taking any medication?
No.
Okay. Do you know where you're at right now?
Davenport University.
Okay. Patients seem happy. Positions seem upright and symmetrical. Speech is clear and consistent. Here I'm checking the patient's oxygen, and her oxygen is reading at 97. Now, are you currently in pain right now?
No, not at the moment.
Up for me, because I'm going to get a weight and a height on you. You weigh 110. If you want to turn around for me, I'm going to grab a height.
Okay.
Put your head back. Your height is 5'6". I'm going to check your hands. Your hands are well manicured and clean. Your skin is warm and pink to the touch. I'm going to check for any clubbing and your capillary refills. It's a +2. No deformation. Symmetrical and round. Your hair is shoulder length, shiny and clean. I'm going to palpitate your head for any baldness in 3 different spots. No baldiness. Your temporal arteries, false. It's a +2. And I'm going to check for your TMJ. I'm going to have you open your mouth, move from side to side, and clench. There's no popping. I just palpitated her maxillary and her frontal sinuses. Check your eyes, your eyelids, your eyebrows seem symmetrical. I'm just going to check your reflex with my pen light just to see your visual test. I'm going to move the pen up. Just follow with me down. And your pupils did retract with the light. I'm just going to check your sclera seems clear and smooth. Your conjunctiva, no crust, no tenderness with it, no redness. Symmetrical. Perfect size of the urethros. The ears are evenly aligned with the head and the sides. They're smooth and elastic. No tender with palpitation. They have small amount of earwax. I'm gonna do the hearing test. I'm gonna word 2 words. Repeat them to me after you hear them, okay?
Okay. Small children.
Correct. The nose is somewhat large but symmetrical and smooth. Now I'm gonna ask you to close one of your nostrils and breathe in, and the other one. The nasal sternum is not obstructed. Nasal septum. No obstruction, no drainage. Now I'm gonna inspect your mouth. Your lips are pink, moist. Open your mouth for me. 32 teeth is present. Your gums appear to be pink and normal. Can you stick your tongue out for me? Your tonsils graze at a 2. Your palate is hard and normal coloring. Your tonsils are pink and symmetrical, as I see again. your cheekbones. Buccal mucosa is pink and normal. Cranial 9 and 10 are intact. Inspect the jugular venous distension. I'm going to palpitate for the carotid pulse. Carotid pulse is present and it's a +2. The jugular venous is a 45 degrees. In the neck for symmetry and lumps. Inspecting the preauricle and the postauricle and the occipital. I'm inspecting the submental. I'm expecting the subclavicle and your tonsils. I'm also, lobes are intact with no swelling. I'm gonna do range of motion. Can you push towards my hand? Thank you. Down. Thank you. Up. Thank you. Wait, is that how you do it? From side to side and push. Yeah. Now push on my hand. And the other one. Can you shrug your shoulders? Okay. Shoulders muscles are equal at each side. The neck is symmetry. The neck and shoulder muscles are symmetrical. Here I'm going to be inspecting the skin for configuration and symmetry of the shoulders and the scapula. Respiration is 13 and regular. Spine is straight with no retraction or lumps. I'm going to palpitate the lungs for any tenderness. And there's no tenderness. I'm going to percuss the costal vertebrae angle. And the tone is resident. I'm going to auscultate the lung sounds. Breathe in for me. And again. One more time. No abnormal sound has been found on the patient. I'm going to inspect the skin of the interior chest. No tenderness was found. I'm going to auscultate the lungs. No abnormal sound was present. I'm inspecting the pericardium. No cracks, regular rhythm. Her heart I inspected her apex heart rhythm. It was 70 for a full minute. The S1 was heard best at the apex, and the S2 was heard in the back, well, in the base. I did listen to both sides of the bell for the different sound. I'm going to inspect the abdomen. Can you raise your head up a little bit? Okay, there's no bulging. Belly button in midline, and it retract with no bulging. Abdomen is symmetrical. I'm going to auscultate for any bowel sounds. All four are symmetric. There's soft gurgling is heard. I'm going to percuss. All four quadrants. No tenderness is found. Going to palpitate. Going to percuss. All four quadrants. No tenderness was found. I palpitate her femoral pulse, and it was 2+. I will be inspecting the skin of the leg for any skin characteristics, and also hair distribution and muscle bulkness. I'm gonna also be checking the space between her toes. No webbing. The pulse is at a 2. Temperature is warm and equal on both sides. No edema is present. Hip, we're gonna do flexion and extension. Good job. We're gonna flexion and extension of the knee. I want to start with inspecting my patient's skin for characteristic, its symmetry, bony structure, and muscle bulkness is equal. I'm going to palpitate her radial arteries. It's a +2, strong. Check her flexion and her extension of her fingers. So she's gonna put her hand on her fist, flexion, flexion and extension. And we're gonna do the finger test. Okay, I'm gonna have my patient raise her arm up straight across from her and over her shoulders. And I just check I'm gonna have my patient touch the back of her head. Okay, I'm gonna have my patient rotate her shoulders. I'm gonna check the strength of my patient's hand. Push down, up, and then push down. Good job. Can you feel this on your head?
Yes.
Any pain with it?
No.
And can you tell me if it's cold or warm?
It's cold.
Okay. No pain on your arm as well?
Nope.
Full and smooth range of motion was fine on both upper and lower extremities. I'm checking your Achilles and your plantar reflex. Good job. I'm going to do the vibration test. I'm going to have my patient close her eyes.
Yes.
Can you feel this?
Yes. Yes. Yes.
Okay, I'm going to do it same thing on your feet. Can I have your feet?
Yes. Oh, yes.
Can you feel?
Yes. Yes.
Okay. Our reflexes were 2+ and bilaterally. Patient's motor skills. We're gonna do heel to toe walk.
Soft gurgles were heard at a rate of 15.
Okay, we're gonna walk on heels.
Now I'm going to go ahead and percuss in all four quadrants.
Walk on toes. And I'm gonna do the Rainbow
Generalized tympani was
test
heard in
for
all four
balance.
quadrants. I'm going to go ahead and palpate lightly to start. Okay.
Okay. I'm also gonna check the range of motion of her spine. Can you bend down as
Now I'm going to do
no
pupil
bulging, spine is symmetrical. No atrophy or tremors or weaknesses. Negative for the Reimers test. Gait was steady and walk was normal. I did check Patience Turger, which indicate that she was hydrated, and it was a +2.